My name is Lijana, and I'm a sports acupuncturist here in Northbrook. And here today we are at Strength Effect with Sterling. If you wanted to introduce yourself.
Yeah, I'm Sterling Stalnaker. I founded Strength Effect here in Northfield. We're a coaching facility that specializes in movement and strength training, generally for the 40-plus crowd, working a lot with post-rehab clients, some chronic pain clients, and then just active adults.
So the way that I actually connected with Sterling is because I was looking for somebody kind of like a corrective exercise specialist, and then I found him and your personal trainer, but you very much specialize in kind of taking a look at a person and seeing what is actually working and not working instead of just giving basic exercises that you would give the same ones to everybody. So because of that, a lot of the times whenever I work with my patients and we actually activate the muscles, then I like to send them to somebody like Sterling or Sterling to actually work with them further, so the muscles that we activate, that they actually get worked. So we wanted to get together today and just kind of answer a lot of the top questions that we get asked, things that people get confused by because there's so much information about it. So the first question would be, actually this is going to be more true or false. Rest is the worst thing that you can do for most injuries. What is your take on that?
Mostly true, generally speaking, right? There are some injuries where you probably just can't do stuff, but those are pretty rare. We know that blood flow is huge for repairing, and we also know that atrophy kicks in pretty quick. We had a guy who tore his bicep tendon, and he couldn't do rows, curls, presses, but we still had him come in. He did squats with a chain around his waist, kept him training. The reason for that is we can see, like, when people take a long break from training, their muscle mass goes down. And specifically with the population we're dealing with, they are that 40 plus, 50, even into their 60s sometimes. Muscle's harder to build and it's harder to keep. We want to maintain that as much as possible. Now, that doesn't mean that, you know, if you did tear your bicep tendon, you're going to come in and do curls, right? Like, you're going to let that area rest. But we still want to train, we want to break down muscles, we want to keep metabolic rate high, we want to keep blood flow going, and all of that's going to help with the repair process while also keeping muscle mass high, which is something we really want to prioritize when we get into our 40s, 50s, 60s.
Yeah. So I think from my perspective, the only time that I tell people to rest a certain muscle is, for example, if somebody comes in with tennis elbow. And a lot of these injuries, they can happen because somebody is overusing the muscle. Like, from your perspective, like, if somebody's playing tennis every single day, they don't let the muscle rest. What's going to happen? The muscle tears and breaks. Without having adequate rest, that muscle is going to be injured. What I see most of the time is if you do rest the muscle too much, which a lot of the kind of corporate America people will do, they're sitting too much. So it's not that they're not resting enough, is that the muscle can actually be weakened, right? In those cases, you want to activate the muscles and actually work them. So the only time that I would say rest the muscle is if you're actually overworking it.
Yeah, I think it's important to differentiate too between, like, a controlled environment and a non-controlled environment, right? So say you have tennis elbow and you go out and play tennis, that's a non-controlled environment where you're going to move in a lot of ways that could potentially aggravate the elbow. Right. And so,
it's the same muscle that you keep working over and over.
Exactly.
And over
and so like in that instance, it might be best to lay off of tennis specifically for a period of time. But that's the beauty of the weight room and training, is a controlled environment. And so we can control the variables of saying, like, hey, we're not going to overload your elbow, but we're still going to make you move. Right. And so I think that's that's a differentiator.
Right. No, yeah, I totally agree. Next, stretching is one of the most overprescribed things in fitness and medicine. What do you think?
I agree.
Why?
So I think stretching is a tool, not a solution. I don't think that there's anything necessarily wrong with stretching. I think a lot of people try to stretch away their problems, when a lot of times they can be, clients come in for an assessment, we look at how they move, and one of the things we're trying to do is we're trying to see, like, okay, where are you restricted and why are you restricted? One category could be tissue, meaning tissues are tight and you need to stretch, but another one could be joints, just the way your anatomy is. Your hips don't glide like other people's, or you've lost space within your hip capsule, which means it doesn't move the way it is, and those are problems you can't really stretch away. Or, a lot worse, somebody's playing tennis, for example, they strain their hamstring and then they try to stretch it, which is the last thing you want to do when you strain a muscle, right? Stretching is a tool. that can be beneficial, but it's not a solution to everything like a lot of people think it is.
I think that's the first thing that a lot of people jump to whenever they're in pain. They're like stretching, stretching, stretching. I don't know where that came from. I think stretching can be okay. It's not going to solve the issue. It's going to be great for muscles that are truly over tight and over contracted. But what I see, it's knowing what to stretch. For example, if that person, is playing tennis and they're kind of in this accelerating movement where they're overstretching their hamstring and they already have a posture that makes that hamstring be overstretched.
Chronically long.
Right, kind of like in sway back position, that elongation can actually tear it.
Yeah.
So it's knowing what to stretch, when to stretch, and that's why it's so important to come to professionals, who actually will take a look at you and based on your posture, be able to tell what is actually shortened, what is weakened, what is long, what can be stretched and should be foam rolled, and what actually needs to be strengthened.
Yeah, because there's a lot of times where something is, like you said, already long per se, right? Or the technical way would be like the brain has down-regulated tone, and it's no longer got tone.
It's taught now, right? It's now taught.
Yeah, and so a lot of times what happens is those muscles become not just long, but they become weak, which is a very vulnerable position to be in. And stretching them and down-regulating tone is just a recipe for an injury.
Which is, I keep mentioning this on my Instagram, but every time I see those basketball players tearing their Achilles tendon, it's like a lot of the times that can actually be the thing that is happening. A lot of those hamstrings can be overstretched and they do like that motion. And then that's what gets there. That's what I actually clinically see in my clinic in most patients, whenever they have Achilles tendonitis or plantar fasciitis. A lot of that is because of that overstretched back line. So yeah, once again, it's true. It's totally overprescribed for most people. Next, most people think that they have a tight muscle when they have a weak one, which is, I think, what we just discussed. And I think specifically with people who are working behind a computer most of the day, what is happening, that posture, of having the shoulders rounded or sitting and those hip flexors contracting, you're pretty much training your body to be in that specific posture all day long. So those muscles weaken, right? Your rotator cuff muscles will weaken if you have this kind of posture. So if you then go ahead and, start having shoulder pain or achy, and then you go and get a massage, actually elongating that tissue is actually going to even make it worse. What are your thoughts on this?
Yeah, so I think of injuries through the lens of injury equals load in excess of load capacity. To use the Achilles example, if your Achilles can only handle, for ease of math, 100 pounds of force going through it, but you are running and come to a hard stop and all of a sudden there's 300 pounds of force coming through it, the Achilles is going to snap, right? And so, that's more of a, just a very biomechanical kind of objective way to look at it. But that's kind of the way I think of it. And so I think that the more we can build resilience or strength through the muscle, specifically in a lengthened position, because almost all injuries happen in a lengthened position. If that Achilles can be in a lengthened position and handle 500 pounds of force, right? This is just a number, but it's going to be more resilient and it's going to be less likely to tear, to strain, to anything like that.
Next question then. Ice is one of the worst things you can do for an acute injury.
100%.
Yeah, you agree?
Yeah, I feel strongly about that one.
I am very, very shocked because I literally have people coming to me after seeing orthopedic surgeons, after seeing PTs. Not all PTs, not all orthopedic surgeons, but a lot of them. And every single one of them is still putting ice on where it hurts 3 months, post injury. And I think what a lot of people are not realizing is that the person, Dr. Merkin, have you read the
Rice guy?
Yes.
Yeah.
So the Rice guy, Dr. Merkin, actually in 2015 came out and said, forget the ice is for dead people. And there's a whole story behind it, but essentially just taking it from Chinese medicine perspective, but in the body, everything is a balance. So if something is hot, and swollen, you may want to put ice on it for, the first maybe 24 to 48 hours at most. After that, you do want to use heat, simply because ice constricts things. So it will constrict vessels, and what actually heals you is blood. So if you constrict things, like if you're a basketball player who needs to finish the game, throw the ice on, finish the game, go on with it. But after that, apply heat only, because heat attracts blood, and blood is actually what heals the tissue. I don't know if you have a different theory behind it.
No, that's 100%. Look, my viewpoint too is that ice is going to restrict blood flow.
Yeah.
When we're trying to heal, especially if we're looking at some sort of soft tissue injury.
Yep.
Like a tendon or a ligament, like that blood flow is key.
Yeah.
And so by icing, you could actually be working against yourself.
Not only could be, you
are.
are. The kind of analogy I like to tell people to kind of understand it better. Think about wooden floors in the wintertime. What do? They shrink from the cold, right? Same thing happens to your vessels. They shrink, and blood is the only thing that will heal the tissue. The only time that people have issue healing is when there's not good enough blood flow.
Yeah.
So we want as much blood flow as possible. So
Which leads back to the point of when you have an injury, like staying active.
Yep.
To some degree, right, is so important.
So important. Movement is life. Pain management clinics manage pain. They don't fix it. I'll take this first. I would say that's true, but you also have to look at the name of pain management clinic, right? It actually tells you in the name what it actually does. It manages pain. So yes, it won't fix the underlying issue, but some people do need something to be able to get through their day, get through their life while they're getting to the root cause of the issue. Now, the problem is a lot of the people go to pain management clinics and think just because the pain is gone, suddenly their issue is fixed. And that is not the case. A lot of the times the issue is joint issues, muscle issues, all of that. So if you just kind of quiet down the signal, which tells you why the pain is there, I mean, you're not fixing anything. So as soon as your medication has worn off or anything like that, the pain is going to come back. So, I mean, you got to take a look at pain management clinics for what it is. It's just there to manage your pain while you actually, get to the root cause of it. What is your take?
Yeah, I agree. It's kind of like foam rolling, where it creates an opportunity.
Yeah.
Right? So if you
you're doing it, yeah.
If you have chronic pain, and that's preventing you from doing things that, one, you enjoy, but also going to do something like physical therapy that requires exercises that might be painful, right? The pain clinic is a great option to get you out of pain so that you can do the things you need to do to long-term be out of pain, right? But it's a short-term solution to create that window so that you can do the things that are going to benefit you long-term, but it's not a long-term solution.
Yeah, the only problem is that people literally, take it as one and done, and once the pain is gone, that they no longer have to do anything, and it's just you have to know what it's for.